Hi everyone, how are you doing? Hope you're doing good. Welcome to Baby Chakra, and today I'm Dr. Swetha. Uh, I'm Dr. Swetha Shesham, a consultant obstetrician gynecologist and fertility specialist practicing at Lakshmi Healthcare Hospital, Vanastalipuram, Hyderabad. Today I'm here to discuss about sciatica in pregnancy. Okay, so thank you, Baby Chakra app, for giving me this opportunity to discuss this session with you and interact with you guys. And I'm available for online consultation on Baby Chakra app, and my referral code is SWES. I repeat, my referral code is SWES. So let me tell you something about sciatica and pregnancy. Sciatica is seen in almost 50 to 80% of the pregnant women. So it presents as pain in the buttock, which usually radiates down along the thigh. And in few women, I can see we usually see sciatica radiating till the foot. So there are other symptoms like numbness, numbness or tingling in the foot or in the region of the pain, that is along the thigh. And few women experience deep dull pain, and this is mainly because of the hormonal changes which occur in pregnancy. So a relaxin hormone can be blamed for this. During pregnancy, what happens is, due to the effect of hormones, mainly the relaxin hormone, all the ligaments and joints, they become a little relaxed. As the name says, relaxin, it means it relaxes the ligaments around the bones. Ligaments are something which join both the bones. So there is little relaxation, and the space is created in between these bones. So there is little laxity in your pelvis, which helps this all to facilitate the delivery. So at times, women may experience sciatica early in the pregnancy. That is, maybe in the first trimester onwards. And certain women, like most of the women, may experience back pain towards the end of the pregnancy, mainly because of as the baby grows and as the pregnancy advances, the baby and the uterus, the entire weight compresses the sciatic nerve, which is present in the lower back. So this causes pressure on that nerve, as a result of which the woman may experience pain, kind of shooting pain or burning pain. You can also experience tingling, numbness along the course of the nerve. So uh, what we see normally is this sciatic pain usually gets relieved after delivery, immediately once the baby is delivered, and all the hormones are restored to normal as in pre-pregnancy. Then the pain usually, they people women get rid of this particular pain. So normally there are other causes of sciatica, that is disc bulge, as well as compression due to other causes such as tumors and all this, which are usually rare in pregnancy. Okay, so this is just a brief note about sciatica in pregnancy. I'll take your questions today. So I repeat, I'm available for online consultation on Baby Chakra app. You can download the app and use my referral code. It is SWES. So I thank Cipla also, in addition to Baby Chakra, for giving me this opportunity to interact with you. I'm taking the questions now. Uh, Rachel asked me, "Hi doctor, does drinking water help sciatica?" Hi Rachel, good afternoon. Drinking water definitely helps you in pregnancy, because water is vital constituent of your food in pregnancy, because water helps restore the blood volume. Blood volume, as I told you, increases about 40 to 50%. It almost increases to a vast extent. So water plays a vital role, not just in sciatica, but in your rest of the pregnancy. So is heat or ice better for sciatica? Rachel, I can tell you, you can apply hot packs, that is hot fomentation. You can apply it shouldn't be too hot. It should be moderately moderately hot, or warm that helps you get relieved of this pain. So you can apply this along the course of the pain, that is from in the buttock area or in the thigh or in the foot region. So it would help you. Heat is better than ice. And Rachel also asked me what triggers sciatica and is sciatic nerve right or left? So, as I told you, relaxing hormone as well as baby compression, these are all the factors which trigger sciatic pain during pregnancy. And sciatic nerve right or left? Sciatic nerve is present both on the right as well as on the left. It is one of the major nerves, which is one of the major nerves that's present at the back. So it's present on both the sides. You can experience sciatica on the right as well as on the left. So one thing which we advise for the one thing which we advise is that turn on the opposite side of your pain. That is, if you have pain on the right side, you should turn towards your left side, as well as go for a little physiotherapy. And there are certain exercises which help you get relieved of sciatica during pregnancy. And I repeat, you have to take the opinion and strict you have to practice all these exercises under the supervision of a physiotherapist only or a doctor only. And please do not do all these vigorous exercises on your own. This is not advised. So I'm going to the next question. Revati Rajamani asked me, how early do you get sciatica in pregnancy? So sciatica is experienced right from first trimester in few women, and as the pregnancy advances, it can be seen in towards the end of the pregnancy. So it can be seen anytime during the pregnancy. It's mainly because of the compression or due to laxity of the ligaments. I have another question from Bhavana. How can I sleep with sciatica while pregnant? Okay, I'm answering. Hi, Bhavna. So normally during pregnancy, especially in second and third trimesters, we advise women to sleep on their left side. This is to enable good mobility, as well as it reduces your pedal edema, that is swelling of the feet. So, but in cases with sciatica, we usually advise women to sleep on the other side of the pregnant, like in other side of the pain, I mean to say. So if your pain is on the right, turn towards your left. But try to avoid sleeping on right. That's the best thing. Does coffee help sciatica? Okay, does coffee help relieve sciatica? You mean to say, Lakshmi Mishra? Hi, Lakshmi Mishra. So food usually has got no effect with sciatica. You can have coffee, but do not take excessive coffee. Maybe half a cup, small cup, or 1 cup a day should suffice. It's always better if you take milk during pregnancy. You can take about 200 ml of milk twice a day. This helps. All the nutrients, vitamins and minerals, especially calcium, which is good for the development of the fetal bones. Okay, so it's always better you take milk instead of coffee or tea. Also, make sure you give a little gap between your tablets, medicines, as well as this and this coffee or tea, because there are certain components in tea and coffee which prevent absorption of calcium and iron. So, Lakshmi also asks, do bananas help sciatica? Again, I can tell you there is no relation between food and sciatic pain. So you can take anything, but a little less sweet fruits like you can take apples, you can take oranges, or you can also take lime, sweet lime. It's better to avoid bananas and obviously mangoes are not available now. Don't go for fruit juices if you're diabetic. Lakshmi Mishra also asked me, how can I stop sciatic pain? Uh, I've told you, you can use hot fomentation, that is application of heat along the course of the nerve, or you can also go for physiotherapy to get relieved of this pain. And you can go for mild painkillers like paracetamol, about 650 milligrams per day. So in case you have excessive pain, so do not take other painkillers which are not prescribed by your doctors. You have to consult your nearest gynecologist for in case your pain is excessive, because it could also be due to other reasons. Your pain could also be due to other reasons, not just sciatica. So be careful. And in case it is in case you have vigorous pain, or in case there is some drain leaking per vaginum, or in case you have little bleeding, so you have to consult your gynecologist at the earliest. So Navlaksh Kapoor asked me, how do you permanently cure sciatica? Hi. So there is no permanent cure for sciatica in pregnancy. Once you deliver the baby, you'll get relieved of the pain, as simple as that. So I'll be answering next set of questions. What can Navlaksh Kapoor asked me, what can one do for unbearable sciatica? Hello. So, in case you have unbearable sciatica, there are certain patches, pain relieving patches available which are safe in pregnancy. You have to consult your nearest gynecologist for this. So, do not take any painkiller medication on your own, and please take the advice of a gynecologist for this. You can also consult a physiotherapist. They'll help you out with teaching you certain exercises so that your pain is relieved. But ultimately, once you deliver, the hormones would normalize and then the pain would subside. I'm taking another set of questions. What can make sciatica worse? So as the pregnancy advances, the baby weight increases, and that can cause pressure on your sciatic nerve, which is present in the lower back. So that can make your sciatica worse. So in case you have worse pain, please consult a gynecologist. Do not take any painkillers on your own, because that can make situation even worse. So certain painkillers are not supposed to be taken in pregnancy, because that would damage the kidneys of the baby as well as the mother. So, pregnancy has to be dealt with little cautiously. So, do not take medication on your own. And in case you're allergic to some medication, you should immediately consult your nearby doctor. So, please keep these things in mind, and you should always keep monitoring the fetal kicks, fetal movements, and it's always better to monitor the fetal movements after your meals, maybe thrice a day, thrice to four times in a day, and you should have at least 3 to 4 movements in the hour after your meal. So that can make around 10 to 12 movements in a day. Does walking help sciatica? Durga Salvi asked me. Hi, Durga Salvi. Yeah, walking definitely helps you get rid of sciatic pain, but do not do excessive walking, and try not to try to do minimal exercise, minimal walking. Anything excessive in pregnancy shouldn't be done, because that can go worse. Things can go worse in case you do that. I have a question from Sonam Patel. How should I lay with sciatica? So, hi Sonam Patel. As I told you, you can lay on the side opposite to the pain. That is, in case you have pain on left, turn towards your right and lie down. But make sure you don't lie on your right for prolonged hours, because that can reduce the blood supply to the baby. So be little cautious and take the help of somebody. Take the help and then turn. Okay, do not turn all of a sudden, and do not get up straight from your bed. So turn towards one side and then get up slowly. That would help you. Madhvi asked me, how do I get rid of sciatica during pregnancy? So, hi Madhvi. As I told you, you can get rid of sciatica by physiotherapy, that is doing some physical exercises under the supervision of a physiotherapist, recommended in pregnancy, and as well as those which are prescribed by your doctor. That's it. And once you deliver the baby, obviously everything would normalize and you'd get back to your normal. So once you deliver, you'd get rid of your sciatic pain. Rebecca Prakash asked me this question: does pregnancy sciatica go away? Hi, Rebecca. So, sciatica in pregnancy is seen in about, I told you, 50 to 80% of the people. So, only these, unlike only that particular back pain, sciatica, which women experience during pregnancy, they may be relieved after delivery. But there are certain other causes which are actual, which are actual causes of sciatica, like disc bulge or any compression effects or any tumors or any masses which compress the sciatic nerve. These women also experience sciatic pain along the course of the nerve, or from the point where the compression begins. So these people, they continue to experience the sciatica even after delivery. But most of the patients, those who get sciatica during pregnancy, most of them get relieved after the delivery. So, and only certain cases they continue to have sciatica for a prolonged duration. So those people will require different types of treatment. So I have a question from Manasvi Tamrakar. मैम मेरे पेट में दर्द रहता है. Okay. So Manaswini, hello Manaswini, Manasvi, sorry. पेट में दर्द बहुत सारी चीजों, there are so many causes for the pain in your abdomen. Normally there are certain movements, like there is some minimal contraction which occurs throughout the pregnancy. We call them Braxton Hicks contractions. They get relieved. They are of very short duration. In case वो ज़्यादा है तो more than 30 seconds, more than 20 seconds, और ऐसा ज़्यादा है तो you have to consult your gynecologist. पेट में दर्द कई रीजन से होते हैं. एसिडिटी की वजह से हो सकती है. बेबी बढ़ते बढ़ते पेट ऊपर जाने के ऊपर जाएगा थोड़ा, ये बेबी ऑक्यूपाई करेगा पूरा एब्डोमेन. सो कई लोग एसिडिटी एक्सपीरियंस करते हैं. ट्राई टू टेक मिल्क एंड मिल्क प्रोडक्ट्स and eat small portions of meal. Divide your meals into 6 portions and take small portions of meal throughout the day. And ज़्यादा पेन है तो डेफिनेटली डॉक्टर के पास जाके कंसल्ट होना पड़ेगा. I'm taking the next question from Hema. मैम मुझे सहन चल रहा है, डॉक्टर की दिखाना जरूरी है क्या? हेमा जी, डॉक्टर को ज़रूरी दिखाना है, क्योंकि प्रेगनेंसी में पहले 7 महीने हर महीना चेकअप करा लेना है. कम से कम एक विजिट तो करा लेना फर्स्ट 7 मंथ्स. उसके बाद 15 दिन में एक बार विजिट करना होगा. और जब 9th मंथ शुरू होता है ना, तब हर हफ्ता जाना पड़ेगा डॉक्टर के पास, जाके आपका सीरियल स्कैन्स, रेगुलर स्कैनिंग और मूवमेंट्स ये सब दिखाना पड़ेगा। डॉक्टर के पास जाके आप आपके ब्लड प्रेशर और शुगर लेवल्स भी जरूर चेक करिए। तो I have a question from Ayushi. हेलो डॉक्टर, मैं एक बार मेरा मिसकैरेज हो गया था, अब क्यों नहीं होती? 3 मंथ से ट्राई कर रही हूँ। ठीक है। हाय आरुषि, कंसीव होने के लिए बहुत सारे रिक्वायरमेंट्स रहते हैं, बोथ मेल पार्टनर एंड फीमेल पार्टनर के हेल्थ और सारे रिपोर्ट्स, हार्मोन लेवल्स, ये सब ठीक होना चाहिए। मेल इनफर्टिलिटी अगर है तो मेल मेन में काउंट्स ठीक से रहना चाहिए, और स्पर्म का काउंट और स्पर्म का मोटिलिटी अच्छा रहना चाहिए, मॉर्फोलॉजी अच्छा रहना चाहिए। ये मेल फैक्टर्स रहते हैं। और फीमेल्स में एक ठीक से रिलीज हो रहा है या नहीं, ये चेकअप करना है। थायराइड और एंडोक्राइन प्रॉब्लम्स, अगर ये सब हुआ तो ये भी ठीक करना पड़ेगा। अगर ये फैक्टर सभी अच्छा है तो प्रेगनेंसी जरूर आएगा। आप वरी मत करना है, क्योंकि स्ट्रेस भी एक फैक्टर है। अंदर अंदर का ये ओवरीज का एनवायरनमेंट स्ट्रेस से भी खराब हो जाता। तो प्लीज बी स्ट्रेस फ्री एंड स्टे काम, डू सम मेडिटेशन और योगा, consult to simultaneously, because there are certain tests which we prescribe for men too, so that would help conceiving early. सो आप हस्बैंड के साथ जाना पड़ेगा, आपके गायनेकोलॉजिस्ट को कंसल्ट कीजिए, स्कैन्स करा लीजिए, फॉलिकुलर स्टडी भी करा लेना, ताकि तब देखते, फॉलिकुलर स्टडी में देखते कि एग बढ़ रहा या नहीं, वो एग रिलीज हो रहा या नहीं। तो सीरियल स्कैन्स करते हैं। तो you have to consult your gynecologist, and please do not overthink about your previous miscarriage. वो जो हुआ सो हुआ, बस भूल जाइए उसको। अभी जो होने वाले हैं, अभी ये जो नया प्रेगनेंसी आने वाला है, उसके लिए आप तैयार रहना चाहिए। So I'm taking next question. Guys, in case you have any question about sciatica, not just sciatica, any other complaint, you can just post it online. I'll answer your questions. So I'm available for online consultation on BabyChakra app. Please download the app and use my referral code. It is SWES. I repeat, it's SWES. And I'll answer your questions online. And thank you, Sipla, for giving me this opportunity to interact with BabyChakra users. In case you have any questions, you can just drop a message. I'll answer your questions. Not just about sciatica, you can ask me anything in pregnancy. Okay, please follow strict diet during pregnancy. You can follow balanced diet. Please do eat everything, all the fruits and vegetables, which help good weight gain of the baby. And please keep consulting your gynecologist once in a while. So get blood tests or blood investigations or ultrasound done frequently. Ultrasound is safe in pregnancy actually, so ultrasound and MRI are safe in pregnancy. Do not get x-rays done for your sciatic pain. X-rays are not safe in pregnancy. Do not get x-rays done on your own, never. And even no CT scan in pregnancy. Do not get a CT scan done during pregnancy, because the radiation helps damages the baby. So radiation is not good for the baby. Gul Muhammad Malik says hello, sir. Good afternoon. In case you have another question, you can please post it online. Macharla Jyotsna says super suggestions, ma'am. Thank you. Yeah, you can also watch my previous videos wherein I spoke about calcium in pregnancy, iron in pregnancy, and nutrition in pregnancy. So, pregnants, please take care of yourselves. Reshma Bhattacharjee asked me, I want to conceive from last 1 year, but I'm unsuccessful. I also have miscarriage earlier. Hi, Reshma. As I told you, there are so many factors for fertility or subfertility, I can say. So, both the partners have to consult the doctor and get investigations done. Even the men, they have to get a scan done and blood investigations, then semen analysis done. So that in case everything is fine, then please do not worry, you will conceive. Also, Rachel says, thanks, doctor, very helpful. Thank you, Rachel. So I'll be available on BabyChakra app for further talks. Uh, Please do follow my talks and post your queries. I'll answer your queries online. And there's one important thing. There are so many other causes for back pain during pregnancy. Even in case you're in labor, you'll experience back pain. So do not get confused with the sciatica. Do not think it is a sciatica and uh, stay home. So please consult your doctor in case you experience back pain or pain. Pain is the abdominal region, or in case you have some bleeding, or in case you have some leakage, or is in case you have some vaginal discharge which is purulent, which is smelling, or any other discomfort, slightest of the discomforts, you have to consult your gynecologist. And please make sure you observe the movements. That is very important. If you have if you do not perceive movements well, or if the movements are a little less when compared to the previous day, so you have to consult your doctor, get a scan done, and get a scan done, or the gynecologist would suggest you accordingly. Do not neglect anything, especially when you're pregnant. So I thank BabyChakra as well as Sipla for giving me this opportunity to interact with you, to have live chat with you, and to answer your questions. So I'll be available on BabyChakra app for your online consultation. You can consult me online using my referral code. I repeat this, it is SWES. I repeat, SWES. You can log in on BabyChakra app with my referral code, and you'll get my talks and my articles on pregnancy, which would be of some help to you. So I've answered quite many questions today. Thank you so much, BabyChakra users, for posting your questions. I hope this talk is of some use to you, and I hope to see you soon with another talk on a different topic. So download BabyChakra app and let your friends know about the BabyChakra app, and let them also follow the various articles which are being posted on the app, and have a stress-free pregnancy. And please stay home and stay safe. Do not go outside unless it is emergency. So take care of yourselves, pregnant women. Thank you so much.